Hi, good morning, everyone. Thank you for joining us for our webinar about coordinating vaccine access for Michigan homeless shelters. I'm Laurel Birchfield. I'm the Associate Director at the Michigan Coalition Against Homelessness. I'm really glad that you're all able to join us today to talk about how you as staff or guests or volunteers with shelters here in the state of Michigan are able to access vaccines for your guests and your staff, and to learn a little bit about how some of our communities in certain parts of the state have been able to do that successfully. I'm joined today by some fantastic panelists. I will introduce them a little bit later on, but I want to acknowledge that we have some amazing folks here today to share their experiences and to give you all information to help you during this really difficult time. I know that we've all been struggling we've hit the year mark now. We've all been struggling with COVID for a year, and we've all been struggling with vaccines for several months. So first, I just want to say thank you for everything that you are all doing in your community, and want to acknowledge that this is a really tough time right now, and I know you're all busy, so thank you for also taking the time out of your schedules to join us. I want to go over just a little bit of housekeeping. I'm seeing someone put in the question box that there's no audio. Usually if there's problems with audio, you need to either change the way that you're using your audio, so call in, or perhaps even just log out of the system completely and then join us again. I'm not seeing others say that they're having trouble with audio, so it's usually an issue with the format and the program on your end, and I do apologize for that. It's not the best answer, but if you're having trouble, log out, log back in. I'm joined by my colleague Allison today. Allison, would you be willing to put that as a response in the box? Because I'm realizing if they can't hear me, they didn't hear that explanation.
You got it.
Thank you. A couple other housekeeping items. We are recording this today. I know that this was a webinar we put together at fairly short notice, so we will be sending out the recording afterwards. And I do encourage you to share this with your network so that those who were not able to join us today are able to get this information. I'll also be sending out a follow-up with this presentation and with that recording and with the contact information for our panelists so that we can continue this dialogue if necessary and continue to learn from each other about how to get folks vaccinated right now. We use GoToWebinar, so there's a dashboard on your screen that you should be able to see. You'll notice that you are all muted. If you have any questions at any point during this presentation, please send them in via the question box. We are going to hold those until the end of the presentation and our panel, but I welcome you to send those in at any time, and we will do our best to get back to you during this time. And if not, then we will follow up with answers to your questions. I think that's all that I have for kind of housekeeping. Oh, that's not true. I do have this presentation already uploaded as a handout. You should be able to click on that and download it if you want to follow along. It's just a couple of quick slides. Let's see here. Before we kind of get started, I do have a couple questions that I'd like to ask the group. We have a small group today, but I'm hoping that you all are willing to take just a moment to give us a little bit of information about what you're experiencing in your community right now with vaccine access. So Allison, are you able to see the poll? Do we have this up and running?
It is.
Great. So the question is just, wanting to know a little bit more about how you're working with providers in your community at the moment for vaccine access. This is set up so that you should be able to select more than one if I've done it correctly, which I am known to not do correctly. So hopefully this one's right. But let us know if you're partnering with your local health department, your local health centers, pharmacies, any and all of those, or if you're still struggling and trying to get that set up and you anticipate you'll have that relationship built soon. Or if you are at the very beginning phases of this and you don't have any partnerships or any access to the vaccine for your shelter, and that includes staff and guests. And I appreciate it. It looks like we've got people voting right now. We've got about 50% of our folks. I see some folks putting some comments in as well. Thank you. Let us know if you have something to report that's not really fitting into any of these categories. And I want to give it just another second as people are voting. I appreciate you all taking the time and being active in today's webinar. Okay, I am going to close this and share our results. All right, so if you are all able to see this, it looks like we do have the majority of people on the call who have been partnering with their local health departments. That's fantastic. I'm really glad that you've been able to build up those relationships. About 15% of you are working with your health centers. And then about 27% of you have not yet been able to set that up, and 12% of you are reporting that you don't have anything going just yet. And then a very small percentage of you are working with pharmacies. So we have a pretty large spectrum here of how we're accessing the vaccine for our folks at the moment. Thank you again for sharing that. This next question is a little bit more about communication and education and how you feel that your staff for this question are responding to opportunities to get vaccinated. So what percentage of staff at your agency do you think will eventually choose to take the vaccine? And this obviously is guessing, unless you've been able to vaccinate a lot of your folks and you have a really firm understanding of this response. Do your best to guess where you think your staff will be falling. And we've kind of categorized this in some fairly traditional percentage breakout points. So less than 25, 25 to 50%, 50 to 75%, 75% to 100, or I don't know. And at this point, I think you should feel perfectly comfortable saying, I don't know, if that's where you are. And I think we're at about the same point, the same percentage of folks who voted for the last, or who cast their answer for the last one. So I'm going to give it just another second and then share these results as well. Okay. Oh, I may have just cut someone off when they were just trying to vote, but here we go. So these are really fantastic results. For those of you who are participating in our biweekly state partner COVID calls, these questions may look familiar. We asked them last week, and I think that these are higher results than we received on that call. So we have the majority of you saying that you believe that about 75 to 100% of your staff will be receiving the vaccine this as soon as possible, as soon as you're able to get it, and that's fantastic. About 28%, 50 to 75%. About 9% of you are saying that you don't know yet. And again, I think that given where we are, given how fast everything's changing, that's understandable and perfectly fine that we still have a lot of questions about how the people are responding to the vaccine. One last question, if I may. This one is the same exact question, but this time I want to know about clients or guests. So specifically, if you're in a shelter that has the availability to get the vaccine now and you have been trying to vaccinate your guests, I'm really curious about kind of what response rate you're getting. Do you feel that there is hesitancy among your guests that's making them less likely or less interested to take the vaccine as soon as it's available? So same categories, less than 25%, 25 to 50%, 50 to 75%, 75% to 100, and then of course, I don't know. This one may be a little bit harder for you guys to kind of process where you think you fall in. So I'm going to give you just a little bit longer to think about your answer, as I see people are a little bit slower to respond this time around. And then we'll close down our polls. All right, let me go ahead and close this and share our results again. So if you're seeing our results, you see that this is very different than our expectations for our staff. For our guests, we have a much higher percentage of you who are not sure. And then quite a few more of you who feel that you're going to fall in that much lower range of perhaps 25 to 50% of your guests choosing to receive the vaccine. Very few of you selected that you think 75 to 100% of your guests will be receiving the vaccine once they are able to do so. So thank you, everyone, for taking the time to answer those questions. That's really helpful for me to kind of process where we are and where we think we are going as we're talking about trying to increase access and coordinate with our communities and make sure that we are doing the best that we can to get the vaccine into arms for folks who are interested in receiving it. So Allison, can you update me? Am I showing my screen at the moment?
You are not in presentation mode though, but we see your screen.
All right. How about now?
Perfect.
Thank you. After a year, you think we'd all be used to all of this virtual stuff, but we still have some things that catch me up. So before we get into our panel and I introduce our panelists, I wanted to just go over some of the guidance that has been updated. I have a link here, and if you download this PDF as a PDF, it is an embedded link, so you can download the document that is regularly updated. I believe this link is an evergreen link, so it should be the same as they update the document. But this is the MDHHS vaccination prioritization guidance. So they have been constantly reviewing and revising this and trying to make sure that they are following national expectations and guidance about who we should be vaccinating and when. and using our social vulnerability index to make sure that we're getting the vaccine into the people who are most vulnerable and most likely to catch COVID-19 and suffer from the worst consequences of it. The good news is that after advocating with some of our other state partners, on March 8th, they opened up vaccines to those who are not only serving, so our staff in congregate homeless shelters, but also those who are living in them. So our guests have now been eligible and able to access the vaccine at the state level for a little while now. Now, that does not mean that everybody has equal access. Obviously, the amount of vaccine dosages that are available in your community differ, and the relationships that we'll be talking about in a little bit also affect your ability to have access and large access to the vaccine. So I am not saying that you should all be getting the vaccine right now, but you are eligible to have your staff and your guests receive it as of March 8th. We fall within the Phase 1B Group B section, which states workers in homeless shelters as well as residents given congregate settings could facilitate the spread of infection. This is the most recent updated guidance from this document. I wanted to include this just because there has been a lot of advocacy and push to make sure that we are also vaccinating and providing access to vaccinate those with disabilities and caretakers of individuals and children with disabilities. So I wanted to have this up here. It's less relevant perhaps for our population because they already fall into a broader category of availability and eligibility. But wanted to just put up on the screen the information. I think that as we are trying to not only vaccinate those we serve and those that we serve with, but also our family members and ourselves, I think it's important that we kind of keep up to date with these guidelines as they change, so that we're able to make sure that we're going to hit that we're doing everything we can to hit that 70% threshold and goal for our state by the end of the year, so that we can get that much closer to herd immunity. And here is just, again, the most updated chart. This is something that they come back to really regularly. And when they announced that they were opening up vaccination starting in April for anyone over the age of 16, they dramatically moved up that last bar that shows who is eligible and how quickly folks are going to be eligible. And in the spirit of sharing our stories about vaccination, I'm very excited that just this week I was able to schedule my vaccine for April 6th. I fall into the very lowest category of that 16 to 49 years, not covered above. But I am able to get in and get my vaccine in just a couple weeks, and I am extremely excited about that. So enough from me. I do need to just kind of wrap all of that up by acknowledging that I am not a staff member of the Department of Health and Human Services. So what I am sharing with you is not any private internal information. All of this is publicly available on their website and in that document. And I do encourage you, again, to stay up to date. Follow MDHHS on social media. Make sure you sign up for their email alerts so that when they make announcements about eligibility and changes to access, you have that and you're able to incorporate that into your work and into your personal lives. Now, let's turn to the folks you actually really want to hear from, and that's our fantastic panel. I think that we have some really great representatives to speak about what they do, how they've been able to bring vaccines into their communities and serve those who are living and working in our homeless shelters. So on our panel today, we have Dr. Jenny Bush, who is a pediatrician and director of pediatrics and COVID response coordinator for Cherry Health in Grand Rapids. She graduated from MSU College of Human Medicine and did a residency at DeVos Children's Hospital. She has 2 teenagers and also wanted me to share that she is also vaccinated. We also have Jim Rutherford. He is the health officer and director at Kalamazoo Health and Community Services Department, obviously in Kalamazoo. He earned his MPA from Central Michigan University and has been working in the public health field for 30 years. And he served in the Governor Snyder's Public Health Advisory Committee. And then we're also joined by Sarah Jacobs, who is a fantastic coordinator of director of the Kalamazoo COC, obviously in Kalamazoo, and has been recommended by the Department of Health and Human Services for us to contact and coordinate with for the excellent work that they're doing in coordination out of that area between all of the different providers. So thank you to all of our panelists. I am so very excited that you're able to join us and that you are willing to share your expertise and your knowledge about how you've been able to increase access to this very vital piece of the puzzle in recovering from COVID. So before we get started into questions, I just want to make sure that we have all of you on audio. If you can unmute yourselves and just say hello.
Hi. Hello.
Wonderful. All right, and let me go ahead and I'm going to put the first question to you, Dr. Bush. You are with Cherry Health, which is an FQHC or a health center. Can you explain to us what an FQHC is and what its broader purpose is in your community?
I sure can. So FQHCs are federally funded entities that are able to provide services to people who have decreased access. We are a nonprofit. We have to provide comprehensive primary care. So in our case, that includes adult medicine, OBGYN, pediatrics, dental, vision, behavioral health. We do a lot of other little things, some corrections and reentry work, and some other programs. We use AmeriCorps volunteers a lot. To be a federally qualified health center, you have to be located in a community that has a high need and have to have a sliding scale available for people who fall under a certain income level. For us, we also have stipulations that for the homeless, we just waive the sliding scale fee, so we don't charge anything for services for them. But most people have to pay $20 for a visit if they're not insured, and if they qualify for a sliding scale program. And then we have to have a board of directors that's at least 50% made up of our own patients. So a good representation on our board to make sure that we're representing the people that we're serving. Sorry, I'm looking at some slides that you can't see right now, but our demographics information, we serve about 96% of our patients that we serve are at or below the 200% of the federal poverty line. So most of the patients we see do have higher needs than the general community.
Dr. Bush, I apologize. You did mention you had some slides that you wanted to share. Would you like me to set you up as a presenter so you can do that now? I apologize. I did forget.
No, that's okay. I just glanced at them while I was talking, so I think I went over just about everything that was in them already.
All right. And I apologize if I cut you off. Was there anything else that you wanted to share with the group about what an FQHC does or what you do in the community?
No, I think that pretty much covers it. For Cherry Health, we've got a lot of different offices. So we're home based in Grand Rapids, but we do have some facilities in Barrie and Eaton and Muskegon and Detroit. So we're kind of all over the state. I'll turn it back to you.
Jim, Laurel's asking in the chat if you can talk about the LHDSs. Her mic is not working.
I think you're muted, Jim.
And we can't hear you right now.
We still can't hear
you.
It says he's unmuted.
All right. Well, while Jim is trying to figure it out, I think I am back. Can you guys hear me okay?
Yes.
I tell you guys, even after all this time, we still have technical issues. Jim, are you by chance like plugged into a headphone or anything that could be preventing us from hearing you? No. Would you mind, if you go up to your audio function, there's an option to try calling in. I actually just clicked on the call in option and then back to computer audio and it started working. So let's try that for you. To everyone who's watching, I apologize. That's strange that we had two audio issues at the exact same time, but thank you for hanging with us. And while Jim is trying to figure out the audio issues on his end, I'm going to kind of turn back to Dr. Bush and ask you to talk to us a little bit about your role with vaccine distribution and specifically how an FQHC is kind of uniquely operating in this world of getting those experiencing homelessness vaccinated right now.
I'd be happy to. So I think in general, as an FQHC, we worry about our homeless population and their health in general. So even if the federal government hadn't turned to us to say, hey, we want the federally qualified health centers to be a significant part of vaccine rollout, we probably would have been reaching out to the homeless anyway to try to make sure that they're getting what they need. But that was the government's directive, is to try to have any community health centers, including federally qualified health centers, to be a major access point to ensure that the people with high social vulnerability index are getting access to the vaccine. The government has really pushed directly sourced us with vaccine. So right now I'm getting vaccine from the federal government. I can get it from my local health department, and MCAH from the state level is assigning us some vaccine to give as well. And I think all three of those entities have encouraged us to use vaccine for the homeless population right from the beginning for the shelter staff. So we were immunizing shelter staff right away when we were allowed to, and strongly advocating at the state level to please let us get to the sheltered individuals too, because we all felt like they were a higher risk than some of the other groups that had already been prioritized ahead of them. So very exciting day when the announcement came out. Exciting and confusing, because when it first came out, it wasn't quite as clear as what you showed. It was worded kind of funny. So I was like, I think that means we can go. And everyone else was like, does it? But we got clarification from the governor's office that yes, you can go. So we were vaccinating in our biggest shelters that week. That first week we were ready to go and get in there. Our first experience was we didn't have the Johnson & Johnson yet at that point, so we used Moderna, and we did have a very high no-show rate for those second doses. So I'm sorry, that's a little bit incorrect. So when we did shelter staff, quite a few of the shelter staff that we vaccinated were also homeless people who work in the shelter. So those are the people that we've had a hard time getting the second doses to, because we're not to a second dose point yet from our after March 8th point. But the initial shelter staff that were homeless, probably about 50% no-show rate for those second doses, which in general our no-show rate is very low for second doses. Like I'd say less than 10% probably. But then after March 8th, we did get the Johnson & Johnson. So we have had a few events where we've went trying to serve specifically the homeless shelter population. We've tried to target the times that the shelters tell us they'll be the busiest. So for one of our shelters, they're very well known in town for being where you go for breakfast, and they have a line around the block every morning at 7 o'clock for people that are ready to get in and get breakfast. So we're setting up at that time for them. We tried to do some pre-registration work, because that makes it go a lot faster on our part. If the patient's already in our system, we can get them checked in and get them vaccinated a lot faster. But that really didn't work very good. We only ended up with, I think, about 25 or 30 people vaccinated that first day that we went, which to me, I'm looking for numbers in the hundreds. So that seems like a low number to me. But then when I later looked back and reflected, I thought, you know what, those are 25 or 30 people that would not have been able to get the vaccine any other way. So I guess we should be proud of that, even if it is a slightly smaller number. We are planning to start going back every week on Monday to that same shelter. And with that plan, we're going to plan to not make them pre-register, which we know is going to make it go a lot slower when we get there. but I think that will serve the population better than expecting them to sign up ahead of time, have information sent to us, and then come back at the right time later. So hopefully that will work out well for us. And then another one of our shelters, we're going to be going at the check-in time for, if you're going to stay there that day, you have to be there by a certain time. So we're going to be there right at check-in when they've usually got a really high flow.
Thank you for sharing all of that. Some really excellent kind of advice about things that have worked for you and not worked for you, and how you've been able to adapt that. So thank you. I'm going to see if Jim is able to join us with audio now.
I think I might have it figured out. Can you hear me, Laurel?
Yes, we've got you.
Good. You probably lost my video, but you have audio now.
We can still see you. We lost you for a second, but you're back. Yeah.
Okay, good. Good.
So Jim, I'm hoping that, I mean, we heard from Dr. Bush about all of the unique ways that FQHCs are kind of able to serve the population, but we saw from our poll results that a lot of folks are working with local health departments. So can you talk to us a little bit about a local health department and its role both in the community and with vaccine access right now?
Sure. So in the state of Michigan, there's 45 different local public health departments. So each health department is under the direction of a health officer. Many have Board of Health, some report directly to county administration, which is what we do here in Kalamazoo County. You know, beyond just there's mandated local public health services that every local health department has to do. Beyond that, you know, communities such as Kalamazoo County, we're fortunate that we have a lot of different programs that we've been able to provide, and many of which are developed specifically for the needs within our community. So we have, you know, under our umbrella, I have the Area Agency on Aging. I have a Veterans Committee program. We do a lot of maternal infant health programs in Kalamazoo County. We have a relatively high infant mortality rate, particularly very high infant mortality rate for African American babies that die before the age of 1. You know, we work in, I think, very coordinated fashion with entities like the United Way. We have great partnerships with our Family Health Center. The Continuum of Care is the group of leaders that oversee a lot of the activities, particularly related to our homeless population. So as it relates to COVID specific, obviously local public health departments have played, I think, a very important role in terms of upfront testing of populations for COVID, assuring that we have appropriate, you know, public health availability for quarantine and isolation for this population. So we worked with entities like the United Way. We have had regional quarantine and isolation hotels that were set up just specifically for, I mean, when an individual in a shelter or an encampment, for instance, is positive for COVID or has had exposure to somebody that is positive for COVID, obviously they're not able to quarantine and isolation in those environments, given that oftentimes there's just not the room to be able to do that. And they also need, you know, they need medical attention. They need a lot of special needs because of the fact that they're quarantining and isolating. So we worked early on establishing some of these hotels with, again, some of the local funds that were available through grants. And we also, and Sarah can go into more detail about this, we also, as a community, set up some hotels for lowering the census at our shelters. Early on, we had a significant amount of outbreaks within our homeless population, and again, that's much more challenging than the average, you know, person that has a home to go to. We struggled significantly with our shelter staff. First and foremost, their own health issues. Many of them became, you know, sick with COVID. We got down to a point in time where, you know, we were wondering, you know, is it going to be a challenge to keep some of these shelters open? So those were the darkest days for us with COVID were about a year ago this time, when we were having these quarantine and isolation facilities. At any given time, we would have a 60-room hotel full and other relief hotels full as well. So those were very challenging times for all of us. But again, I think in a coordinated, in a collective manner, we were able to address that. But we were fortunate to have the resources to do that as well. In terms of vaccinations, we have vaccinated all of the staff within the shelters quite a while ago. It's probably been at least a couple of months since we undertook that activity. We have started, again, in partnership with our FQHC, vaccinating our homeless residents. We are using the Johnson & Johnson one-dose product. It's got great utility. What I like about the J&J product is that it's 100% effective at eliminating or reducing the likelihood for hospitalization and significant illness. We have great partnerships with both our health systems, both Bronson and Borges. However, it's a pretty significant challenge when the ER is full of COVID individuals and they can't discharge because there's nowhere to send these individuals. We can't send them back into the shelters when they need to be isolating from other individuals. So the Johnson & Johnson product has great utility for vaccinating our homeless population. We began that this week, actually. We had a clinic, I believe, what day was that, Sarah? Monday? Tuesday?
It was Tuesday.
So Tuesday, and we vaccinated, it was only 65, and it's estimated, we have, over 600 homeless residents in our community, some of which are in a hotel now, some of which are at shelters, and then we have some encampments as well. So just what the value of what we have here is a mobile unit where we can go out and vaccinate at these environments. We have also talked about, we have a relatively large venue for large vaccination initiatives where we're averaging about 3,000 doses a day, and then just trying to get transportation for these populations. Yesterday, Metro Transit indicated that they're providing free bus rides to anybody that wants to come to the Expo Center to receive their vaccine as well. So a lot of work that has undergone for the last year. And again, it's really, everything is attributed to, great partnerships. I think that's how we're able to move the needle here in Kalamazoo County. I don't know, Sarah, if you want to add anything to that?
I don't think so. I think that pretty much encapsulates a lot of that effort for sure.
Well, thank you, Jim. And Sarah, I was going to turn to you next. You're in a very, you're in a position where you kind of are able to see all the different pieces as a COC director. And I'm wondering if you can share with us kind of a little bit about how you were able, in your position and with your partners, to coordinate some of this with Jim and with some of the other partners you're working with when you started, and kind of how you've gotten to where you are now.
Sure. So yeah, with that, our COC is housed at the United Way here. We work out of that office, so we've got a lot of great support from them as well. But so yeah, a year ago, it was, we didn't, the information was, get 6 feet between you. That's kind of all we knew, right? So it was a matter of how do we make this work in a safe way? And so looking at that and, really just pulling together, our entire COC, the community that works within that population, and then pulling in the, philanthropic dollars to make that happen in a hotel intervention is what we've done back then. And as Jim had said before too, at the time it was, we thought, we were thinking that we may end up shutting down just due to the fact that a lot of staff were getting sick and things like that. And we didn't know what, there was a lot of unknowns at that time. the community really did, we were able to, work together and, take the guidance from, from county, from our health department to really understand like what the parameters are that make it safe, right? And really kind of bring all these different pieces together. And again, with our COC, we already had work groups around our shelter groups that were meeting regularly and things like that. So we had a lot of these groups already in place. It was just a matter of kind of bringing everybody into the same room. And then again, taking that guidance from public health is, okay, this is what we need. How do we get there? And then, pulling the philanthropy and just all of these different pieces together. So.
Thanks for sharing that. And it sounds like, at least in Kalamazoo, and Dr. Bush, I don't know if this is something you guys have utilized, but the idea of going to meet folks at the shelters, using mobile units, and also working with transportation to get folks who are at shelters or unsheltered or whoever you're serving to vaccination sites. Can anyone speak to kind of that coordination around moving people or meeting people where they need to, where they're already at for vaccination?
I'm happy to talk about that, Laurel. So we've done a combination of both of those things. We have a large drive-through site at our central location. So when people have had a small number of people, they've got 3 more staff that sign up or a few more residents that decide they want to do it, we're just having them bring them to our drive-through site to get them vaccinated that way. But as much as we can, we're trying to go on site. There are some smaller residential shelters that are a little bit more stable. The people who stay at them for long periods of time, and we've went out to them and just vaccinated everybody they could get to sign up, and that's worked fantastically. So far, all the shelters that we've been to have had a space for us to use, so we haven't had to use our mobile unit, but we do have one, and we are planning to possibly drive to some of the encampments to see what we can do there too. I think that might be a little bit lower on our priority list, just because I know those are going to be days that, in an hour we'll be lucky to get 3 or 4 people vaccinated. So it's not going to be as high yield as our shelters are, but we do have that on our to-do list to plan a day to just drive through the tent cities and see if we can get people to sign up there as well. I think the most important thing is that we've formed really close connections with the staff at the shelters, so we can be flexible and have a discussion of what's going to work best between the 2 of us, because the same thing doesn't work the best at every place. So trying to figure it out. And we are also going to be in contact with one of the hotels that's being a shelter right now too, and try to get to those people as well.
Thanks for that. Jim or Sarah, was there anything else that you wanted to add around like transportation or meeting folks in certain locations for vaccines?
Yeah, I echo Dr. Bush's comments in terms of you really have to have the connection with the shelter leadership. Those are the trusted individuals within this community. We have a history, as well as our FQHC, of really serving this population. So our nurses know these individuals. They know their families. So we've developed the trust, but it always helps to have. I think we've always coordinated our clinics and our testing around the continuum of care, because those are, the elders within that group. Those are the wise people that say you need to think about this, this, and this. So we wouldn't consider doing it without that connection. The other part of it too is providing education up front. I mean, they have questions like anyone else in terms of safety, in terms of efficacy. What kind of side effects am I going to encounter? The other part was just, I think, the other thing is you can't look for a fit. I mean, all the time that we're doing this, there's this big push at the national level to vaccinate as many people as possible. So, I have one model that is, it's like a factory. It's again, probably upwards of being able to do 5,000 a day eventually. Vaccinating the homeless is not an efficient process, and it can't be. You have to take your time. You have to meet them on their terms. You have to explain what you're doing, work with them in advance, make them feel comfortable with it. There's a lot of reluctance, and understandably so. I mean, this is a marginalized population that typically doesn't have access to health care, many of which have to use the emergency room as their primary only source of care. So for them to see a nurse, it's kind of a unique situation. And even to get a vaccination, nationally we struggle vaccinating just for seasonal influenza. Our success rates are really low. So it's very telling that we struggle with this population, just like structural local public health struggles with reaching Black and brown communities as well. And we've had lessons learned with how we're getting to these populations. Churches are essential to get into both of those different communities, and we've learned that, and we've been very successful because most people in that environment, they trust their ministers and their pastors more than they trust somebody in a white jacket, and we know the history and why that is.
Thank you, Jim, for sharing all of that. I think you touched on so many things that are really good for us to hear. We're coming up on the end of our time together, and I do want to save space for questions and encourage and invite folks to be sending those questions if you haven't already, using that question box. And I'm going to let people kind of think through any questions they may want to ask while I acknowledge some of the things that Jim just said there at the end about concerns and education. We are trying to put together a second webinar in this series about vaccines for individuals experiencing homelessness, where we hope to bring in some more folks to talk about some of those issues that you raised, Jim, about historical reasons for distrust and hesitancy, and how we can be communicating around this. So many folks are already out there doing this amazing work, and I've attended meetings where I've seen this kind of information put out. So if you're already doing that and you're interested in presenting to a larger group, please contact me. I'll make sure that you all have my information, because we are still identifying folks for that webinar and scheduling that. But I want to acknowledge that I've heard a lot of fantastic advice from this panel about how to coordinate, how to vaccinate, how to meet people where they need to be met in order to really serve them. Are there any other, before we get to audience questions, are there any other recommendations or advice that any of you have as folks in our communities? And we have folks on the call from small rural communities and large urban communities and everything in between. So I know there's a lot of different challenges we all face. Do you have any recommendations or advice for those on the call that we haven't already discussed? And it doesn't have to be just about vaccine access. If you have something that you've learned about education, or I mean, I think something that I'm hearing that's really fascinating to me is you've acknowledged that your numbers are lower than you want them to be, but how we should still be celebrating that, because this is a very hard to reach audience and hard to work with all of these different nuanced challenges. So if you have any advice about communications or education, I think this is a great space to share that too.
So we do have some questions if you would like to start. Oh, go ahead, Dr. Bush.
No, go ahead. I was just going to say one of the ways that we're trying to increase those numbers is just starting next week, we'll be going to the same place every week at the same time. So I think that they'll be able to post signs that say we will have COVID vaccine at this time every week, and hoping that will kind of get the word out there a little bit better and be easier than so far we've been very reactive instead of planning ahead. We got some doses of plan where we're going to use them for this week, but now we're getting to the point where we can try to plan ahead. Hopefully that will help.
That's excellent. I feel like we've all been reactive this entire year, so that sense of being a little bit ahead of it must be such a relief for you.
I think one of the things that kind of helped us was just, sorry. I thought you were done. No, I was just going to say, one of the things I think that's been really helpful for us has been just making sure that we are prioritizing and we meet weekly to discuss these things and make sure that we're, planning and having extra planning meetings if necessary, but also within that being, just being aware that it's likely that, there's going to be a point where you may have to pivot in what you're thinking because of, how each, sector of this population might react a little different. So just be ready that even your best laid plans, sometimes, you get out there and your participation levels might be a little low, and it's like, okay, well, how do we pivot then and build that trust a little bit better, a little more incrementally. As Jim said, they can do up to 5,000 a day, and sometimes it's kind of like, okay, well, we did a few hundred here. How do we even break that down a little further to kind of build that trust slower in some of the areas that we're in. So
thanks for sharing that. I think the idea that this is a long-term process for us is something we have to constantly remind ourselves of.
Yeah.
And Allison, it sounded like you were about to bring in some of the questions.
So we had the comment that I think Laurel highlighted earlier, that someone has an on-site nurse practitioner that is administering single doses. Then our first question is if vaccines are available to unsheltered individuals, which I believe the answer is yes, but if someone just wants to confirm that.
So under the guidance that I shared, and I'm going to go back on the screen so you guys can see this language, it specifically says congregate settings, and I have seen language that kind of specifically calls out this homeless shelters language. So I believe I'm going to ask Dr. Bush and Jim to perhaps chime in for how you guys have interpreted that. I think that a lot of unsheltered individuals fall within some of the other, perhaps some of these categories that are also eligible due to health conditions or age. But as a explicit group, I don't believe the state has prioritized them. Jim, Dr. Bush, do you have a different take on that?
So, I've reached out to the state health department on several different occasions because we were very anxious about, explaining to them this has been a very challenging population for a year. The sooner we can get them vaccinated, the better. And, I kept getting back that if for instance, when it was 65 plus, the response from the state was, you can vaccinate homeless residents that are 65 plus. You can vaccinate homeless residents that have pre-existing health conditions. And at some point in time, every local health officer has autonomy in how they want to disseminate the vaccine. I've watched other counties, do that, and we've done that. So we just made a decision. I'm not going to go in and just pull aside portions of this population. The vast majority of homeless people have pre-existing health conditions. They have mental health issues. So I didn't have any issues whatsoever making the decision that we're going to start vaccinating this population. It might not have coincided exactly with what the governor's guidelines were as it relates to prioritization, but for us at the local level, when we're spending in a given week, we could be spending $20,000 a week of being able to provide quarantine and isolation. I'm not going to hesitate on getting this vaccination or this vaccine into that population as soon as possible. That's probably not a very politically correct answer, but it's the one I've got.
I appreciate that answer. Dr. Bush, do you have anything you'd like to add?
And I agree with Jim. The Kent County Health Department's been very aggressive with wanting to get our homeless population vaccinated. In fact, before the statement was released, they were trying to convince me that I should just go do it. And we were a little hesitant. As much as we wanted to do it, we also didn't want to go against the governor's orders that strongly. But at this point, I feel like it's close enough and we can just do it now, and that it's the right thing to do.
Thank you for that. Allison, do we have any other questions?
Yep, we have 2 more so far. So the next one is, do you have any information on vaccine access for organizations who help with transitional housing for individuals experiencing homelessness?
So I will say that we don't have anything prepared from the Coalition Against Homelessness. Sarah, is that something that's come up in the COC that you might have some info on?
That hasn't been asked directly. Again, looking at, congregate populations and those types of folks. And then frontline workers within that, a lot of times there's overlap for people that are working in rapid rehousing and the shelter work. So I'm not sure if that's why that hasn't come up specifically for us, but it hasn't been raised at this point.
We treated workers in these environments as 1B essential workers. So we've provided, as soon as we opened up 1B quite a while ago, we considered those workers to be essential workers. And I believe we vaccinated those individuals months ago, the same time that we were vaccinating employees within our shelters.
So I think, Allison, for me, the answer that probably is going to be appropriate for a lot of these questions is coordinate with your health department, coordinate with your health center. If you have questions about access for any of these populations, work with them directly.
And don't be afraid to make noise. I mean, if they're not, look, I have 260,000 residents in Kalamazoo County. Everybody wants, vaccine, and really, I don't know what I don't know in terms of every nook and corner. So it's been brought to my attention, hey, did you know that this environment exists? And that's when I say, no, let's get them vaccinated. So make noise and appeal to your health officer and your respective community and demand nicely getting the vaccine.
Demand nicely, okay. I like it.
We have a few more, so we'll see how many we can get to before noon. This question is directed at Dr. Bush. Is there material that I would be able to give my staff and residents of the shelter information pertaining to the vaccines that are being developed by different sources? For example, Johnson & Johnson versus another developer. We are getting questions. People are confused.
I don't have resources right off the top of my head to list for you, but I can send some to Laurel if she has the ability to send them out. I know we have a community vaccine coalition that has specific work groups on different populations, and they did try to make some handouts about the vaccine that were going to be a little bit easier to understand. Laurel, did you mention that you have something too?
Yeah, thank you. So I am part of the Protect Michigan Commission. It's a statewide commission that's working on communications and education, and they are continuing to work on materials. I'll send out the link to what they have developed as well. I'm happy to send on anything that you are able to provide, Dr. Bush. At the Coalition Against Homelessness, we're trying to put together something that is based on CDC and DHHS information that is a little bit more specific to those experiencing homelessness, so speaks to them directly. And we're hoping to have that available here soon. I had intended to put this in the poll question and wasn't able to do so. So in our last few minutes, as we're answering your questions, if you have specific requests for materials, such as information about the new vaccine and how it compares, or anything else that you think would be valuable for your agency or your clients and staff, please drop that in the chat box and let us know, because that's the kind of information we're trying to take in as we put out information that we hope is valuable to all of you. Allison, do you want to move on? I know we don't have a lot of time for the last couple of questions.
Yep. So one question is, are these different vaccination options available through FQHCs available across the state, or are these options more in bigger locations like Grand Rapids or Kalamazoo, or are they available in rural areas as well?
I would encourage anyone to contact their local FQHC, no matter where they are, because I know from the state level, some of the like far up in the UP, FQHCs were slower to get vaccine than the bigger ones. I think as a big FQHC, they targeted us to get it first. But from what I've heard, every FQHC has been given some vaccine now. And I would think that almost all of us would prioritize homeless people high on our list. Some might prioritize their own patients first, but once they get through their own patients, they should be moving on to groups like FQHC or like the homeless. So I would definitely reach out. I wouldn't be shy to reach out to them and the health department to see what can happen. For my county, our health department often reaches out to us. I think that's how we made our initial contact with our shelters, was the health department saying, Cherry Health, can you please take these 5 shelters? And we were like, sure, we're happy to take them and vaccinate their staff. And then once we had already made that connection, then we just kept going from there with the shelters.
Okay,
Kim,
we'll
did you have-
probably only have time for one more because we only have 2 minutes. So another one is, are FQHCs across the state having similar relationships with local domestic violence shelters, leadership, and vaccinating those staff and residents?
I imagine they probably are. Mine specifically hasn't, again, because we're in a big community coalition, and I think other organizations got assigned to help out those populations here. But I would think that would be amongst the populations that we would usually be happy to serve. So if we would have been asked to do that group, we would have.
How about in
And in
Kalamazoo?
Kalamazoo County, I'm sorry, go ahead.
Nope, I was asking you. Go ahead.
In Kalamazoo County, we've got the YWCA is scheduled, I believe, for next week, and our FQHC will be performing that clinic. So those shelters are part of the considerations for vaccination clinics.
Thank you. Allison, we're right at noon basically, and it sounded like that was the last question anyway.
Yep, we're good.
Perfect. Well, let me again thank our panelists. I know that you are all extremely busy, so I can't tell you enough how grateful I am that you took the time to spend this hour with us. I also want to thank all of the attendees, also extremely busy people. You're all doing amazing work, and I am so glad that we have you on the front lines providing these services and the support for folks right now. I will be sending out follow-up information. If anybody has any additional questions for any of our panelists, please let me know and I'll do my best to get answers for you. But thank you so much. Have a great day, everyone. And I will let everyone know about our next vaccine webinar as soon as we have it scheduled. Thank you.
Thank you, Laura.